Chapter 18, Blood, Screencast 3. Now, this screencast will be focusing on leukocytes or white blood cells. Now, if we look at the primary characteristics associated with white blood cells, keep in mind what their underlying job is. Their job is basically to defend against pathogens, and they're very different from other red blood cells. Keep in mind they contain a nucleus and organelles, but not hemoglobin, so their job is not to transport oxygen. They are extremely motile and flexible, and generally we find them not in blood but in tissues, and that makes sense because once again their job is tied into immunity, and they will be transported through the blood to a site of injury or an area where they'll actually be able to do their job. There are a couple of terms that are tied into white blood cells. One is diapedesis, and this is the process of how white blood cells actually squeeze through the blood vessel wall, because remember, they're going to be doing their job outside of the blood. Now, chemotaxis, that is the attraction of leukocytes to chemicals that have been released at an infection site. So kind of think as far as a white blood cell magnet. So at the site of the injury, there are these chemicals, and they're going to draw towards them the white blood cells. Now, there are a total of 5 different white blood cells, and they're divided into 2 subclasses. They're going to be described as either being granular or agranular. If the ending is PHIL or PHIL, they are considered to be granular, whereas sites, CYTE, are agranular. The granular white blood cells are neutrophils, eosinophils, and basophils, whereas the agranular are going to be lymphocytes and monocytes. Now, as noted previously, we're dividing them into 2 distinguishable classes based on the presence of granules. And once again, the granulocytes are going to have visible granules that are visible with the light microscope. And once again, those are the neutrophils, eosinophils, and basophils. The agranulocytes, they have these much smaller granules that are not visible with the light microscope. Those are going to be the lymphocytes and the monocytes. Now, if we want to look at most to least, the order is going to be neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So that's most populous to least populous when it comes to the types of white blood cells within our body. Now, first, let's talk about the granulocytes, and the first that we'll address are going to be the neutrophils. They are the most numerous of all white blood cells that we will find within our blood. They have a very distinctive multi-lobe nucleus, and the cytoplasm has these very pale granules when stained. Now, what they're going to do, they are going to enter tissue spaces, and their process of protection will be phagocytosis, and that's what they're going to do to infectious pathogens. Neutrophils will rise dramatically in chronic bacterial infections. Eosinophils, they account for 1 to 4% of all white blood cells. They are bilobed nucleus, which are connected by thin strand. The cytoplasm has reddish granules, and they phagocytize antigen-antibody complexes or allergens. They are most active in cases of parasitic worm infection. We have basophils. They account for about 0.5 to 1% of all white blood cells. They have a bilobed nucleus, but now the cytoplasm has these blue-violet granules that contain histamine and heparin. Histamine will actually cause a change in capillary permeability. It's going to result in increasing the blood vessel diameter, and so they're responsible for a lot of classic allergy symptoms. Heparin will actually inhibits the clotting of blood. Now, the 2 agranulocytes, monocytes, they have a C-shaped nucleus. They account anywhere from 2 to 8% of white blood cells. They actually will take up residence within tissues. They are going to transform into these large phagocytic cells that are macrophages, and their job is going to be to phagocytize bacteria, viruses, and debris. Now, lymphocytes, they reside in lymphoid organs and structures. They account for 20 to 40% of all white blood cells. They have a dark staining round nucleus, and they come in three categories. T lymphocytes, those are the lymphocytes that are responsible for managing an immune response. B lymphocytes, they actually will become plasma cells and eventually produce antibodies. And then we have NK, or natural killer cells, and they are actually going to attack abnormal and infected tissue cells. Now, clinically, there's something known as a differential count and changes in white blood cell profiles. Leukopenia, that is a condition in which there's a reduced number of white blood cells. This is something that will significantly increase the risk of infection. Leukocytosis, this is an elevated leukocyte count, and this could be caused by a recent infection or stress. The differential count, that is measuring the amount of each type of leukocyte and whether they are immature. These are going to be very useful for many clinical diagnoses. Now, when we talk about leukemia, that is a malignancy that is found in white blood cell forming cells. It really is the abnormal development and proliferation of white blood cells. Generally, it's going to be characterized by an increase in abnormal white blood cells, and because of this, there's going to be a decrease in red blood cells. And the issue here is potentially resulting in anemia and bleeding. There are two types of leukemia. First is acute leukemia. This is a leukemia that has a very rapid progression, and typically death occurs within months in children and young adults. Chronic leukemia is a leukemia that has a much slower progression, and it generally will be found in middle-aged and older individuals. Now, platelets, these are the small membrane-enclosed cell fragments. They do not have a nucleus, and basically they break off of megakaryocytes within the red marrow. They play a very important role in hemostasis. Typically, there's quite a few of them, anywhere from 150,000 to 400,000 per cubic millimeter of blood. Many of them are stored in the spleen, actually about 30%. They generally will circulate anywhere for 8 to 10 days, then they will be broken down and recycled.